As you know, according to the last report from the General Authority of Statistics in Saudi Arabia, in 2022, Saudi population around 33 millions, 40% of the population less than 25 years of age, and 32% of them in the pediatric age less than 18 years. As you know, all the prevalence of various childhood rheumatic diseases varies across different regions of the world. For example, the prevalence of GIA ranging from 3.8 to 400 per 100,000 children. Also the prevalence of lupus from 3.3 to 8.8 in 100,000 children. Unfortunately, we don't have registries or epidemiological data from Saudi Arabia for childhood rheumatic diseases. Also, GIA being one of the common conditions seen in pediatric rheumatology clinic, seem to be the spectrum of juvenile idiopathic arthritis in Saudi population. Also in the Asian is different than what has been reported in Western countries. In some cohort studies in Saudi Arabia showing that the systemic onset and polyarticular GIA is the most common, while in Western reports, oligoarticular GIA is the most common subtype. And if you can see this clearly in different cohort from 1997 to 2019, almost systemic GIA accounting for about 30%. In the last study in 2017, 60%, although the number of this study is very limited. Also, regarding the chronic anterior uveitis, it's less common, seems to be less common in Saudi children with juvenile idiopathic arthritis. And in retrospective study from Western Saudi Arabia included 587 patients. The GIA as a cause count for less than 5% in that study. Another study done in 2017 included 888 uveitis patients. The GIA as a cause was 5%. And in a recent study from Eastern Province included 222 patients. The GIA count for 7% as a cause for chronic anterior uveitis. Lupus reported to be more severe in Asian, including Saudi Arabia. And the renal and CNS involvement are more common than those reported from West and associated with higher morbidity and mortality. I believe we have more cases of familial and monogenic lupus, especially with the higher rate of consanguinity in our community. Acute rheumatic fever, although its incidence is decreased with over years, it's still not uncommon in our area. And the children with juvenile idiopathic arthritis can be misdiagnosed with acute rheumatic fever and be treated with penicillin therapy for their arthritis due to the lack of awareness among the pediatrician and general practitioner. In Saudi Arabia before 1989, there was no pediatric rheumatology service at that time. And the care of children with rheumatic diseases in Saudi Arabia was provided by pediatrician, adult rheumatologist, or orthopedic surgeons. Since 1989, pediatric rheumatology subspecialty has been established in King Faisal Specialist Hospital and Research Center in Riyadh. And Dr. Sultan Bahabri, rahimahullah, he established the pediatric rheumatology clinic in King Faisal, and he worked to increase the awareness among pediatricians and initiate and promote research in pediatric rheumatology field. Also, he has established satellite or outreach pediatric rheumatology clinics at several Ministry of Health hospitals. Regarding the patient care, currently pediatric rheumatology service is available in the major cities of Saudi Arabia. Not all of the rheumatologists is working full-time as rheumatologists, but they have general pediatric coverage. However, the patient load is different between institutes. With the availability of more pediatric rheumatologists, we noticed that early recognition and referral of the cases is improved. Also, the interval between symptoms onset and diagnosis getting shorter. This graph showing the 13 provinces of the Saudi Arabia, you can notice clearly that the most of the pediatric rheumatologists is available in Riyadh and Makkah al-Mukarramah area. Almost around 40% of our rheumatologists is in these two cities. Still, some provinces without pediatric rheumatologist, and some of provinces with only one pediatric rheumatologist. Some of the pediatric rheumatologists is working in universities, and there is no hospital, newly initiated universities, and no hospital available, or they have limited served population. On the other hand, some of them work in military hospital and they cannot serve civilian population. Challenges, we have challenges in a lack of awareness, and this can lead to delays in diagnosis and treatment, and potentially causing long-term complication for the affected children. Limited number of specialists, and this shortage can result in longer waiting times for consultation and limited availability of specialized care, especially when even if the rheumatologist available, there will be only one rheumatologist, and when he went in vacation or he cannot cover the service, nobody is covering his patient. Diagnosis and referral delay. This especially happens when rheumatology service is not available, particularly in the region outside the major cities. Access to care is in the underserved areas may face challenges in accessing the specialized pediatric rheumatology care due to geographical barrier or lack of healthcare infrastructure or limited resources, because rheumatic diseases need a multidisciplinary team approach, and sometimes even if the rheumatologist available, he don't have the other allied and supported services like immunology and the immunology labs and histopathology and other services needed. The other challenges is the transition of care, and the transition of care of pediatric patient with rheumatic diseases to adult rheumatology service can be complex, even in the well-established tertiary centers. Opportunities. We have the opportunities in increasing awareness and educational programs, conferences, and workshops can help improve recognition of symptoms, early diagnosis, and appropriate referral. Saudi Society of Rheumatology, since it has been established in 2010, doing a great effort in this part. Workforce development, expanding the number of pediatric rheumatologists, providing incentives and scholarship for medical students and residents interested in pursuing pediatric rheumatology can help to build a skilled workforce, especially from the areas and provinces there is no pediatric rheumatology. When they finish their training, they will go back and serve their community. telemedicine, and telemedicine helped to overcome the geographical barrier and improve access to pediatric rheumatology care. Also, using teleconsultation and virtual education can provide support to patient and healthcare provider in underserved area, enabling better disease management. Patient support and advocacy, establishing the patient support groups and advocacy organization can provide a platform for families affected with pediatric rheumatic diseases and to share their experiences and access information and seek support. Regarding the education, in 1995, in King Faisal Specialist Hospital, when Prof. Mayouf joined Dr. Sultan there, they start with a structured program, and Dr. Mayouf did a great effort in working with Dr. Sultan, rahimahullah, and he built with and continue what Dr. Sultan did to improve the specialty and improve the training and awareness. And most of our pediatric rheumatologist, senior pediatric rheumatologist is a graduate of this program. And in 2010, the program has been recognized by the Saudi Commission for Health Specialties as Saudi Pediatric Rheumatology Fellowship. Then in 2017, our colleague, Dr. Wafa Suwairi, our senior rheumatologist, and her colleague in National Guard, they start a new second program, training program in 2017 in King Abdullah Specialized Children's Hospital. In 2018, another program started in King Fahad Medical City, all of these programs in Riyadh City. Then Dr. Abdurrahman Asiri and his group in Prince Sultan Military Medical City, they established a new program. And lastly, in 2022, Dr. Ulfat and the group with him, they start a pediatric rheumatology fellowship program in Al Madinah Al Munawwara. Currently, this is the 4 program in Riyadh, and 1 program in Medina is the available training program in Saudi Arabia. Educational activity. Since 2009, Prof. Mayouf started the Riyadh Pediatric Rheumatology Club meeting. Was held physically and monthly since that time. And during the COVID era, we switched it to virtual, and this gave opportunity to other colleagues to join from other city, and people like this participation, so we changed the club meeting as virtual since that time, and it has been done monthly. We are doing the Saudi Pediatric Rheumatology Forum. Last one done in 2022. We did. It was done annually, and it's done 7 years consecutive. Unfortunately, the last year we couldn't do it due to logistic issue, and this forum was aimed to approach the general pediatrician and family physician, and usually done in the peripheral cities, not in the central cities. Hopefully, we can be reactivated this year. Prof. Mayouf initiated Saudi for specific disease forum for specific diseases, the Saudi forum for autoinflammatory and immune dysregulation for the last 4 years. Last one done in 2023 in last September. And another forum for childhood lupus. We did also done annually, and we did three meetings so far. and last one was done in this area in November 2023. Pediatric rheumatologists are actively contributing in the annual meeting of Saudi Society of Rheumatology and also participating in awareness days done by the Saudi Society of Rheumatology, and this awareness day done in a different city of the kingdom. Regarding the research, with the vision of 2030, Saudi government actively working toward advancing medical research and healthcare services for children, including those with rheumatic diseases. Most of the research is clinical basis or a case report of new syndromes or data and molecular genetic studies. We have opportunity to do more registries and epidemiological disease prevalence, and to do more prospective studies in disease-specific research and treatment strategy, quality of life, and psychosocial aspects. I know some of the colleagues doing a great effort in this field, but we hope to do more. Collaborative research can contribute to understanding the epidemiology, pathogenesis, and treatment of rheumatic diseases in children, and collaboration between Saudi Arabian healthcare institutions. There is some of this work has been done. We hope for extra involvement and extra collaboration, and also collaboration with international research organization can facilitate the knowledge sharing and advancement of in the field. Potential collaborative work with Bento. I know Professor Mayouf is a member on some of these organizations, and he is doing work with them. Also, Dr. Wafa from National Guard and the group from National Guard is doing some involvement and works with that. We need to improve our communication and the relationship with these groups. And the Arab group, also the Pediatric Rheumatology Arab group from the Arlar, Kara group. In conclusion, pediatric rheumatology service in Saudi Arabia is expanding. Children with rheumatic diseases get the standard medical care, and we hope to move forward in collaborative work, better communications, increase awareness, and utilizing the telemedicine. Thank you.
Thank you, Dr. Abdul Latif. I will be here. Stay there. Thank you, Dr. Abdul Latif, for this good overview for the achievement and maybe some obstacles in our journey. So the floor is open. Typically, the opening lecture, we don't have discussion, but since we have some time, I think we can get some comments, questions from the audience. Well, one of the important suggestions to improve the journey of pediatric rheumatology in Saudi Arabia, I think we have now, mashallah, good number of graduate for each year. At least, you can tell me, maybe 6 or 7 graduate each year. So I don't think it's good or healthy to have more pediatric rheumatologists as general pediatric rheumatologists. My suggestion, and this is what I advise, maybe Dr. Ashwaq Al-Eid was the first fellow at that time, and Dr. Abdel Aziz, Dr. Al-Hanouf, and I think Dr. Al-Ujain. They should specialize in one of the disease to be more focused on that disease, and we have more maybe achievement in certain areas. So you have only pediatric rheumatologists, maybe we have enough number. Now we need to move forward to have, for example, Dr. Najla, she did great job from lupus training, and she's expert in lupus. So we should have more people specialized in certain diseases. So I don't know, what do you think? The program of Saudi pediatric rheumatology, is it ready to accommodate, adapt this concept, to maybe to have third year? The program of pediatric rheumatology is 2 years. So can we consider third year as optional to accommodate those who have interest, for instance, lupus, for instance, autoinflammation, and others? Depends on the center, of course, if they can accommodate.
Yeah, I think the Saudi Commission currently is providing the subspecialty accreditation, and I think we did accreditation to Dr. Nashawi. He did 1 year auto-inflammatory in Germany, and he applied to the Saudi Commission to be accredited, and he has been accredited as auto-inflammatory subspecialty in this field. So I think can be done. And if the center apply for the subspecialty program and give the curriculum for the training, how it will be done, the Saudi Commission will approve it definitely.
I'd like to hear from those who have maybe more experience. Dr. Abdullah Sumbul, maybe he was the chair, the ex-chair of Pediatric Rheumatology Board. He is the head section of Pediatric Rheumatology in King Faisal. I think the facility in King Faisal, maybe National Guard also, they have the facility to forward for something like this. Dr. Abdullah.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Sulaiman. Thank you, Abdul Latif, for this informative presentation. I think the suggestion by you, Sulaiman, is probably one further step to improve probably the graduates of our training programs. However, it can be probably in some selective centers where you have the facilities to accommodate such subspecialty. However, what I would suggest, if you add a third year, probably part of that third year can be probably elective rotations or collaboration with some centers for like few months. For example, 3-4 months, or even up to 6 months, which would probably improve the quality, especially if you talk about some centers in the world where they have probably some specialized subspecialty training program.
Abdullah, if you will ask for collaboration, there is no point to consider third year. I'm talking about national subspecialty. And this is the point. If you send trainee abroad, you will lose the game.
But again,
because you cannot compete and you will not be able to promote your center. My point, you can consider, of course, other centers, they can consider it. For instance, let us take lupus as an example. You can take lupus with research center to consider basic immunology, basic research training, and this will promote. Dr. Wafa, I think she wants to comment.
Thank you, Prof. Sulaiman. I totally agree with you, and I think it's time to do this step after the successful experience of training in general rheumatology. We have very good graduates, and they have done a great job at the time when they go to their centers. And it's time to add this more step for subspecialty, especially in selected centers where they do have an advanced clinical care and research care in their centers. And it's always come to my mind, I don't know whether the scientific council, they have looked at it, what is the projected number that the country needs from pediatric rheumatologists over the next 10 years? What we have now is good, but what is the projected number for general pediatrician and subspecialized based on what we know about the prevalence incidence, although we don't have enough epidemiological data, but we have some understanding and some concepts and some knowledge about this. So what we have now, is it good enough for the next 10 years? Do we need to double it? Do we need to triple it? Number one, how many of those subspecialized care are needed? And especially if you do the training, you need the facility. So if they are highly specialized in, for example, lupus research, how they are going to practice if they are going to end up, for example, in a geographic area or a healthcare system that is not going to support their advanced research. It will not happen without collaboration. So this is a challenge, but I think it can be very well addressed and taken care of.
صبحكم الله بالخير جميعا. Thanks عبد اللطيف, thanks Prof. Suleiman. And I will add point from academic affair point of view and Saudi Council regulation. So to have sub-specialty, because the Saudi Council now, they have a new regulation for sub-specialty thing. They call it level 3 program. So I think the one we are talking about, it's applied for this concept in the Saudi Council. So this is the concept now. Saudi Council will bring all these sub-specialty to the center. So each center, if they think they want to establish any new sub-specialty program, they will take care from A to Z, even from the matching system. They are the one in charge for interview, make the matching, doing everything, make their own curriculum, their own assessment. Even the certificate will be from the center. Yes, it will be accredited by Saudi Council, but without accreditation. So they will not, for example, he will be accredited as a pediatric rheumatology lupus, but he will given a certificate, what they call it, competency certificate or area of focus competency. They call it level 3. But definitely, but with very, very stricted, really standard rules. You can start with one center, two center with one, or to have really agreed to compete with others, because you can establish any subspecialty, but then the outcome maybe is not really competing with other. If our aim to compete really with other, we need really very strict to establish such thing.
With that, thank you very much. Dr. Ulfat, ما نقدر نرد يعني.
Thank you very much. Actually, the idea is okay, but I don't think we can apply it because all of us are general pediatric rheumatologists. So if you want to make it, we should have first someone who is really specialized in this specialty in this center, who took the subspecialty, for example, abroad, and then he can establish. But for us as a general to teach a subspecialty, I don't think it's applicable. Sorry for that.
يعطيك العافية. Dr. Abdul Latif, thank you very much. With that, thank you very much.